The ankle exam, starting with inspection. Note any swelling, erythema, atrophy, deformity, or scars from the front, side, and back. Take particular note of the medial longitudinal arch. Here, there's a good intact arch, but note this other foot that has a fallen medial arch. Looking from behind, you can also see the alignment of the Achilles as it attaches into the hind foot and the calcaneus. Special note should be made that a good gait exam is always part of your examination of the lower extremity. Next, we're moving on to palpation. We often start this examination at the proximal tib-fib joint in the fibular head. Certain ankle injuries can transmit force and injure this region, including a mesoneum fracture. Next, feeling the lateral ankle, remember to palpate along the lateral malleolus. For more detailed assessment of this region, please look at our Ottawa Ankle Rules assessment video. Here we're palpating the base of the fifth metatarsal. Ensure you also palpate the ligaments of the lateral ankle, including the CFL, the ATFL, and the PTFL. Next, palpate over the medial ankle, including the malleolus. Your palpation will extend into the midfoot, including the navicular bone, and then not shown here, but continuation down into the forefoot along each of the phalanx. We also palpate the medial deltoid complex. Next, palpate the anterior ankle, including the anterior talar dome, as well as the tib-fib joint. As you continue palpation along the joint line, make sure you check with the patient if there's any discomfort. Posteriorly, you're going to palpate down the Achilles tendon to its insertion along the calcaneus. You can then palpate over the calcaneal fat pad, as well at the origin of the plantar fascia. Finally, movement. Make note of observing dorsiflexion, plantarflexion, inversion, eversion, as well as toe extension and toe flexion.